Okay, I would like to just talk about vaginal infection. Some ladies will call it toilet infection. How we need to manage them, especially for well-being, and the way it should be managed, and how we also manage them in the spa. But let's look at what causes this vaginal infection and or toilet infection. Usually it's what would cause it will be poor personal hygiene, whether when you use the toilet or when you use public toilets and they are not clean, or it had some bacterial infection already resident in those toilets and then you use them. It might be contact or with people that are already infected with the bacteria, or even poor washing sanitary procedures. That's poor washing techniques for your personal undies. Okay, so first and foremost, it's advisable, if you suspect in any way that you are having symptoms of the infection, vaginal infection that comes with itches, scratches, discomfort, discharge, the first thing is to seek medical attention. Go to the hospital, go to your GP, your family doctor, or a specialist for female health, and see them so that they can test. You go through the normal tests and they will give you antibiotics and other form of medication, both the ones you will take and the ones you will topically apply in that area, so that you can get treated. But now, after that treatment, you need to now come back. Like, your body needs to restore its normal flora that it needs for that area to become healthy again. Because there's a normal bacteria that's supposed to be there that fights bacteria that invade the place. It is when that normal flora, that normal bacteria is no more there, that you come up with toilet infection. So now, when we talk about how we restore the normal flora for that place, it's very important, because if you don't do this, you will end up treating toilet infection over and over again. Why? Because you are pumping yourself with a lot of antibiotics that ordinarily will kill the resident bacteria that is causing the infection, and will not allow your body to produce the needed bacteria that it needs to fight future infections. I don't know if you get it. So it's very clear. If you get it in that manner, then the problem is already 50% solved. So now, how do we restore that bacteria back to the normal flora of the vagina? First and foremost, you make sure that you don't wash your vagina with soap. Like, you don't use your bathing soap to wash your vagina. You only use ordinary water, plain water. Even that water must not contain any antiseptic. That water must not contain any antiseptic. It's very important. Okay, that's one. Two, during the period of repairing, restoring back the flora, avoid anything antiseptic or medicated. It's very important, because they will continue to kill the bacteria that want to form, and that healthy bacteria, your body needs it to fight invading, or your body needs it to fight invading ectobacteria that strip you of your natural flora. Okay, so now thirdly, you need to, when you wash your undies, make sure you sun dry them. You don't wash your undies and put them inside the house, because inside the house or inside the bedroom also gathers these ectobacteria that are also the causes of the main things that are responsible for even the infection in the first place. So always make sure that your undies are sun dried. In some books of thought, they tell you to change your undies every 3 months, but I've come to realize that if you sun dry your undies all the time, it can last as long as you want it, except it's getting torn, you have to change them. Do you understand? Yeah. But you make sure it is sun dried. Like, you don't dry them with maybe a washing machine, or you dry them inside your toilet or your bedroom. No. It is only the sun that kills or inhabits the growth of those ectobacteria that are causing the toilet infection. So it's very important. Then it's also very important to keep a very good personal hygiene. You cannot overemphasize that. You must always keep a good personal hygiene for yourself, so that you do not fall back again into the same circle of infection. So that will be all. I hope this helped somebody to get it right.